Doc, welcome.
Thank you.
It's nice to have you here again.
It's always nice to have you all. Yeah.
Jude, the last day is suspicious, Kakra.
Interesting. Oum-Kalsoum Zakaria Adam.
Yes, health practitioner,
A mouthful.
national coordinator for Young Medical Women, International Association of Medical Association of Ghana. Oh, that's a mouthful. Doc, as usual, it's a pleasure to have you. So last week we were discussing head and neck cancers.
Yes.
And let's do a little recap for those who missed it and didn't watch, so that they can have the benefit of following the conversation today.
Okay. So I'll start by just going through a little bit what head and neck cancer is. And I like the picture at the background. It's giving us typically the regions of the head and neck.
Right.
So head and neck is everything that you see in the background. So from the head region to the neck region, which is down here. So the head region, you have your oral cavity, which has the mouth, which has the tongue, which has the flesh around the teeth as well. And then you have the spaces within the head region, which we call the sinuses. And then you also have the larynx, or your throat behind, and then your larynx, where your verbalization, or when you talk, where it is produced, that's the voice box, okay? And then the neck region. So these are the regions that are defined typically as the head and neck region. And when you have cancer, which is the uncontrollable division of cells, that's end up infiltrating any of these regions, then we see that we have head and neck cancer, depending on the subsite that is affected. You get it? So we made mention of a lot of the risk factors that are associated with getting head and neck, and we spoke about the modifiable factors and then the non-modifiable factors.
Yeah.
So the modifiable factors are the factors that are as a result of our lifestyle choices, as a result of our lifestyle behaviors, that we can actually have control on and then modify it or change them. Okay, so these included tobacco use, smoking, various avenues where we end up using tobacco that we mentioned about shisha use.
Even as a secondary smoker and all of that.
Exactly.
Yeah.
And then we also mentioned alcohol use, and that the fact that every single unit that you take per week is actually significant now to put you at risk of getting head and neck cancers. And then also the fact that if you do have tobacco use as well as alcohol use, it means that you have
double.
Exactly, and that is very, very deadly. We also mentioned HPV virus
Through oral sex.
Through oral sex.
I remember that.
Yes, and then we also mentioned some other. Maybe we didn't mention this, but I should just add it. Occupational hazards.
Okay.
So occupational hazards like inhaling wood dust, asbestos, and all of that. So people who work in these areas should be aware of it, and then make sure that they are protected whilst working. So use of face masks that are effective, and then goggles as well as protective gears anytime they are working. And then we came to talk about the non-modifiable factors like age. Once you're aging, it's cancer. It's something that is very your cells are predisposed to getting cancer. And then we also spoke about sex, being a male, predisposing you much more to getting head and neck cancers as opposed to females.
Let's talk about family histories.
Yes, and then family history, which is also another
part of it,
of the non-modifiable. Yes.
So does it mean if somebody in your family has had cancer before, then it means you're at a greater risk as compared to the... But why so?
It all has to do with the genetics. It means that that person's genes has some mutations that can easily be transferred to the family line or the offspring. So it predisposes you to getting the cancer as opposed to somebody who does not have any family history of,
does it have to be close family or?
Yes, so usually your first hand family members, like your offsprings, maybe your parents, your mom, your dad, or siblings, exactly. So those category of people, most of the time you should have that genetic predisposition. So you have to have high index of suspicion for yourself, and then have to screen as often as possible so that you do not get yourself in that same situation.
All right, so that's a recap.
Yes, so that's basically about head and neck cancers, and then the risk factors that are associated with getting risk factors, and how do we prevent it? It basically depends on the risk factors as well. So we have to reduce our tobacco use, and then those of us who are secondary smokers, we have to be aware of it and make sure that if there are people who are active smokers, you stay at distance away from them. And then you make sure that you are at areas that you don't unnecessarily predispose yourself to inhaling some of these carcinogens. And then alcohol consumption, drink moderately, or if possible, avoid drinking as much as possible. I know people will not be happy with this one, but I have to just say it.
Whispering in my ear. What is Doc trying to tell us about the alcohol?
This last week, but maybe you could just clarify a bit more for us about the types of alcohol, right?
Okay.
So there are people who are the beer lovers,
type,
right? Down in the beer.
Alcohol, the wine.
Then there are wine lovers,
exactly.
Right? They like the sweet tooth ones. Then they have the hard liquor
ones.
Then they have the
extra hard, the 100%.
Okay, so how we calculate this is that usually we say the spirits, they are the hard liquor and all of those. And they have percentages ranging from sometimes 40 to about 45, you know. So if you have a tot of it, that's 1 unit. You get it. And then for the beers are usually the ones that, so 1 medium bottle of beer is also calculated as another unit.
Okay.
You get it. And then those who take the wines, a glass of wine is another unit as well. You get it. So as I was saying last week, in the past, there are limits to what you can take per week. So we regard that taking for males, taking about 21 units to about 14 units, it's okay. It's the cutoff point. You get it. And then for females, it was 14 to about 7 units. But now, research has shown that every unit at all per week is significant. So when you come into the hospital, you are questioned a little bit about your alcohol use. And based on these information that you give us, we are able to quantify the amounts that you take. And then we are able to say that, okay, since somebody may tell you that I take maybe wine, about three glasses of wine about in 3 different sittings. So 3 glasses, 3 different sittings in a week. So that puts us to about 9 units per week. Somebody too may come and then tell you that, oh, I take just beer, but I take about 1 bottle 4 times a week. That puts the person at what? 4 units per week. And then the hard liquors as well, we use the tot to calculate so that it gives us a numerical figure to it, and then we are able to do the associations if we have to. So that's basically, I know a lot of people are not happy about it, but even light, yes, even light drinkers are at risk. So every amount is significant.
Someone wants to know that, okay, so they're drinking alcohol, but they're exercising and eating right. Does that cancel out the calculations?
Well, not exactly. Not exactly, in the sense that, yes, the exercise is good.
Right.
The exercise will help you to keep very fit. That's one. And then eating healthy too is recommended. It's actually one of the things that we recommend, that you eat healthy diet, you eat balanced diet, you incorporate a lot of fruits and vegetables in your diet. That helps to it will help boost your immune system, so that if there is anything that is causing harm to you, it would be able to overcome it. Yes, so it actually puts you at a better risk, at a better platform compared to somebody who is not exercising and who is not eating well. Yes, and you know alcohol use, let's say heavy drinkers, they tend to be so dependent on the alcohol to the extent that they don't eat properly. So you are not eating well, you are taking a lot of alcohol as well. So if you are not eating well, your immune system is already down. And then you are taking in the alcohol. You taking in the alcohol to reduces your immune system further down. And imagine such a person is also using tobacco. So the tobacco goes in and then causes all the mutations in the DNA. And then these mutations tend to now show themselves as cancer by causing the uncontrollable replication of these cells, you know.
So isn't then we should be preaching moderation, right?
Yes, moderation. So but even the moderation, as I said, every unit is now significant.
How can you tell me the story? Interesting. Anyway, so last week, we also tried to delve into the symptoms. I remember we began by saying that they look quite similar to other sorts of diseases somebody might be experiencing. But for head and neck cancers, like you are saying, what then will you say are the most obvious among some of the symptoms we spoke about last week?
Okay, so I'll start with just saying a lump. So you finding a lump within the head and neck region, that has been persistent for over 2 weeks.
2 weeks?
Yes, over 2 weeks. So a lump maybe just within the neck region, and then, or a lump around your mouth, or a lump around the facial region, you know, that has been persistent and it's painless, okay, for over 2 weeks. You should be thinking about something and quickly seek medical help. Another could be that when you open your mouth, there's a sore or an ulcer within the tongue. I think we have some few pictures that we can show. Okay, so the picture in the background is showing this ulcer or this sore that has been there for over 2 weeks is not healing. So sometimes you feel that anytime you're eating anything spicy, you feel that you get this reaction, but it's not you would rather use over-the-counter medications to lessen the pain and then go on with it. But if it persists for 2 weeks, please quickly rush to the hospital, because tongue cancers and then the floor of the mouth cancers are very difficult to treat because of how highly vascularized they are. They have a lot of blood supply and they can easily spread to other areas of the body. So you need to be able to quickly pick that up and then come. So any non-healing sore or ulcer that you see within your mouth for over 2 weeks, please quickly have it checked. And then it could also be any growth, abnormal growth that you see within. There's another picture that we can see, any abnormal growth that you can see with an, typically call it an exophytic mass, where it is moving outward. It is actually projecting and moving outward. That is also painless. Quickly see and then seek for help. And then there could also be any whitish patch that is abnormal, that has been there for over 2 weeks as well, on the tongue or even in your cheeks. Any whitish patch, we call them leukoplakias. Okay, that can also be a sign that, okay, this area is beginning to change into a cancer that needs to be
So then when you see all of these signs there, then you know that's
exactly. It's likely you have.
So
yes,
it doesn't necessarily have to be a white patch.
Yes, so we have white
dots or whatever.
No, so it could be white patch or it could be an erythematous patch, which is a red looking patch.
Wow.
Okay, so that can also be. Or it could be that it could just be a lump behind your throat. Okay, so within the oropharynx, that is causing, okay, so we have a picture in the background as well that we can talk to. That is actually causing sometimes difficulty swallowing.
Right.
Or difficulty, what's the name, breathing. It can even affect your breathing, okay? All of that can actually be typical signs of what? Oropharyngeal cancers.
Wow.
And then it could even be just a sore around your mouth. Typically, you see where we ladies put our lipsticks. We call them the vermilion border. So it could be that you could have some small sore there.
We call them the what again?
Vermilion border.
Actually.
Okay, or the vermilion itself. So then usually when you see this sore there that is not healing for over 2 weeks as well, you should quickly have it checked. The reason I'm saying all of these is because even exposure to UV light is a risk factor.
Wow.
Yes, so exposure to UV light can predispose you to getting cancers of the skin, which can manifest around the head and neck region, typically because these are the areas that we don't cover. These are the areas that are mostly exposed to sun or radiation. So once you see something like that in the first picture that was shown, yes, you quickly have to check. And then let me quickly chip this in, maybe in albinos. They are more at risk because they do not have melanin within their skin. So they don't have the melanin. What it does is that it filters the UV light and then it dissipates it so that it doesn't cause damages to our skin cells and then now tend to cause the cancers that we see. So in albinos, it is advised that you have to cover up as much as possible. Use sunscreens if you have to. Use caps, and all of that just to be able to protect yourself as much as possible. And then this would bring me to how do we examine ourselves? How do we self-examine ourselves at home to be able to tell that, okay, there's something that I have seen that is unusual that I can quickly seek help. So I would say that all you need are 3 things. You need a clean finger, then you need a mirror, and then you need light source. So you have to stick to one particular day within the month. So if you want to do it every beginning of the month, stick to one particular day within the month, where you stand in front of the mirror with the illumination. What do? You are typically watching the head and neck region. So you would look on the skin. You are watching first. You look on the skin. You look around your face. You look at the back as well. After looking, then you would want to tense some of the muscles. There are certain lumps that you don't obviously see with your naked eye, but then once you tense some of the muscles, they become much more obvious. Okay. So you turn to the left, it tenses one of the neck muscles, and then you turn to the right as well, and then it tenses one of the neck muscles, which we call the SCM. So if there are any lumps there, it makes it much more obvious. Or if there are any lumps there, it decreases depending on where it is located. After doing that,
briefly on the lump and the swelling bits, just for clarification purposes, how are you able to tell whether it's a normal swelling? Because for some of us, we like football, we play football a lot. You get a swell after being kicked about.
Yeah.
How are you sure it's a swelling that's a result of some hit somewhere, or a lump which could be cancerous?
Okay. So typically for a lump which could be cancerous, it's painless.
Okay.
And as I said, the duration, it should have been there for about at least 2 weeks.
Okay.
And it's not resolving. If it is just your regular inflammation, pain from football or whatever, typically by 3 days, at most 5 days, it should have resolved. And then that will come with some pain.
Okay.
You get it, as opposed to this cancerous one, which is painless. Okay, so after watching, the next thing that you do is that your fingers, use your fingers to touch. So you touch around to see, to feel if there's any lump there that is unusual. Okay, typically around your face as well. Then you would watch the vermilion region. You would watch there as well, and then see if there's any sore, if there's any color change, unusual that you haven't seen before. Then you are going to use your clean fingers. You are going to evert your lips, both the lower lip and the upper lip. So you evert and just watch the cheek. What is happening? Is there any color change that is unusual that I haven't seen this in? It hasn't been there, but then it just came in. Okay, so you check that. Then you would open your mouth very wide. after opening your mouth very wide, you protrude your tongue outward. So once you protrude your tongue outward, you're watching. Is there anything there that's is a sore that hasn't healed for over 2 weeks? Is there any lump there as well? You would check for all of that. Then you move your tongue to the left whilst protruded, and then to the right. The reason I'm saying this is very important because these are the areas that are hidden. That it's likely you may just protrude your tongue and you wouldn't typically examine the borders of the tongue. And those are the areas where the cancers usually start from. They are the most common sites. So you would want to protrude your tongue, move it to the left, move it to the right, and then use the tip of your tongue to touch the roof of your mouth.
It is more practical, I think.
Yes.
Maybe one of these days you should.
Exactly. Then you do that. Once you do that, it helps you see the floor of the mouth.
Okay.
So you check there as well if there are any lumps or if there are any sores or if there's anything abnormal, color changes there as well. Then you would want to say ah. When you say ah, you're able to visualize behind your throat for any abnormality. And this you can do in 2 minutes. Yes, you can do in 2 minutes for you. So make sure that you do it, you stand, as I said, in front of a mirror with good lights and then your clean finger, and you're able to do this in 2 minutes.
So
and
I've seen a patch. I've come to the hospital. I've been tested. It's cancerous. What's the next step?
Yeah. Okay, great. So once you come to the hospital, we usually go through rigorous investigations. So we'll start with doing a biopsy. So a biopsy is we'll take a little bit of it and then look at it under the microscope to confirm that the cells are really cancerous. Once we confirm that the cells are really cancerous, then we'll move to the next step. The next step would be that cancer, typically they don't stay at one place. They move.
They spread.
Yes, they spread to other areas. They can spread to the lungs. They can spread to maybe your bones somewhere. They can spread to almost every part of your body.
Okay.
So typically what we'll do is that we would want to do something we call the metastatic workup, where we'll take a chest x-ray. Sometimes, if the chest X-ray, just to check if it has moved to the chest.
Okay.
If it hasn't moved to the chest, or if we are not getting answers, then we'll move to the next modality, which is to take a chest CT scan.
Okay.
So you check that, and then you are able to tell, okay, it's free. Your chest is free. At least it hasn't moved to your chest, or it has moved to your chest. Then the next thing is you would want to do an abdominal ultrasound. So you check the abdomen as well. So where your stomach is, where your intestines are, you do an ultrasound, and then you check if there are any signs of metastasis to those areas. Once you have done this, then you will be able to correctly stage the cancer. Because one of the...
Sounds so expensive.
Not
is it really the case?
Not too expensive, but for an average Ghanaian, yes, I would say that it is. Yes, I would say that it is. Because the CT scan you'd have to pay for. The ultrasound you would have to pay for. But I think now some of the ultrasounds are covered by the regular national health insurance, which you can get for free.
That's some good news there.
Yes. So then once you do this metastatic workup with the CT scan of the head and neck, then you are able to stage it, whether it's an early disease or it's a late disease. So we have stage 1 to 4. Stage 1, 2 usually are the early diseases. And then we have stage 3, 4, which are the advanced diseases. Based on these stages, then you would know the kind of treatment to give.
Okay.
Typically, there are 3 different modalities. It's either you are doing surgery, or you are doing some chemotherapy, or you are doing radiation therapy.
Wow.
So surgery can come alone, or it could be surgery with any of these chemo or radiation. Or it could be that we may say that, okay, let's do some radiation to shrink it a little bit. Then we can go and do the surgery and then continue. Yes, and then
but
continue with it. Or the next thing would be palliative. Palliative is the last option.
So palliative is that you've accepted your fate.
Yes,
sort of.
and then you would only manage the signs and symptoms as and when they come until you say bye-bye to us.
Wow. But is it possible to have the surgery remove it such that now you're cancer-free?
Yes, it is possible.
For head and neck?
When it is early, at the early stages. So stage 1, stage 2, yes, it is possible that you can have that done. And then sometimes you may follow it up with either chemotherapy or radiation to help take care of any remnant cancer cells. And then you are put on a surveillance schedule where you'll be followed up for some time and then declared cancer-free.
Doc, so we have a question from a viewer. It says, how long will I need to continue treatment? Will I need rehabilitation therapy? Sure, it's in line with what we're discussing
yes,
now.
definitely. So this will depend on where the cancer affected. Yes, so if it affected the tongue and then possibly we did surgery to take part of the tongue, yes. After that, the tongue helps you to speak. So yes, you need some rehabilitation after you have undergone all the treatment modalities. And you see, all of these that we do, the head and neck team is not only one team. So we have the speech therapist there to help you with rehabilitating the patient. You have, so speech therapists are there. You have radio oncology. They usually will give you the radiation and then the chemotherapy. And then you have ENT. And then you even have the voice therapist there as well.
Because it affects your sinuses and
no, the voice, exactly, the larynx.
Oh, you should credit my
you're doing so well. You're doing so well.
Quickly though, what are the common side effects? You know, when you do chemo and radiotherapy, I'm sure there's a bit
yes, there are definitely a lot of side effects. The typical ones is, cancer is what, as I said, it is when the cells are growing at a very rapid rate.
Pace,
Good. So now, typically, normally, when you are having radiation or chemotherapy, it's not only going to affect the cancer cells, but it will affect other cells within your body that are also typically dividing at that rate. And typically, those are where? Your skin cells.
Oh, wow.
And then your hair. So you tend to lose your hair. You tend to have darkening of your skin. You tend to notice that your skin is typically affected because of the fact that it is affecting these radiations or medications tend to affect these typically rapidly dividing cells. So you would see those signs. And then your nails. So it will affect your nails, it will affect your hair, and then it will affect your skin as well. But it will take time for you to bounce back after the whole treatment.
Thank you so much, Dr. Oum-Kalsoum Zakaria Adam. Always a pleasure having you.
Thank you
so much. We are so grateful for the deep insights you bring into some of these things. So there you have a conversation, a continuation really on the conversation that started last week. If you want to have a full grasp of what we've really discussed over the period, you could go onto the ChannelOne TV YouTube channel. Sunday breakfast, you see all of it there. You could get to watch for yourself some of the previous conversation that was had. It was a continuation where we looked at some of the risk factors. We also looked at the symptoms and a little bit of treatment. And our guest, always a pleasure to have Dr. Oum-Kalsoum Zakaria Adam.